Non-vascular AMD, sub-RPE tubules. They are basically ovoidal structures seen in OCT with an hyperreflective border and internal hyperreflectivity located in the sub-RPE space. They are believed to be a variant of calcified structure or alternatively believed to be originating from RP cells also. So basically they are located in the sub-RP space, either lying above the Brooks membrane or floating in the sub-RP basal laminar space. These lesions are not much appreciable in multicolor imaging. In near infrared, the presentation is mostly heterogeneous, but mostly hyperreflective. In fundus autofluorescence, they appear either iso or hypo. And they are not discernible on angiogram also, both fluorescein and indocin angiogram, as there is no evidence of any abnormal filling, blockage or leakage. In OCT angiogram also, there is no evidence of any flow signals corresponding to these lesions. And they tend to remain stable over a longer period of time in number, shape, and reflectivity. And these are the sequential OCT images. The first image is the top one, where the SRT is there at the baseline image. The second image is after 3 years, where the SRT almost appears the same, even though it is tilted towards one side. And this third image is approximately 8 years after, where the SRT appears almost the same. You can see the area of atrophy increases in the infrared images. Coming to the differential diagnosis, outer retinal tubulations appear almost same as SRTs in OCT, but there are notable differences between these two. ORTs are seen within the outer nuclear layer, whereas SRTs in the sub-RP space. SRTs are always solitary lesions, whereas ORT can be multiple, and they are seen in the areas of concomitant with atrophy or fibrosis. Muller cells plays major role in the formation of ORT, which are unlikely in SRT, because most of the time the RP above the SRT appears to be intact and there is no evidence of any ELM defect. Other differences are outer coagulations, which are seen in the atrophic areas. They are curvilinear hyperreflective folds in the Brooks membrane, which are in conjugacy with the RP band. They are believed to represent persistent basal laminar deposits. Another one is calcified nodules, which are accumulations of mineral constituents in the sub-RP space. They also can be mimic SRT because of their hyperreflective core and encircled by the hyperreflective cap. But unlike SRT, they have a glistening appearance in color fundus photograph and hyperreflectivity in infrared. And also there is no backshadowing in OCT. Polypodal lesions can also mimic them, but SRTs are very benign solitary lesions which remain stable for a longer period of time in the absence of neovascularization. Maybe the PEDs associated with them gives a clues regarding differentiating these two lesions. PEDs associated with SRT are generally dome-shaped, whereas the PEDs associated with the SRT are associated with polyper, as we all know, it is like thumb-shaped PED. Regarding their origin, they have a hyperreflective contour and intense posterior shadowing. This optical characterization supports the theory that they may be forming from the RP cells. So to conclude, they are very rare entities. They appear very similar to ORTs in OCT. They are benign solitary lesions which remain stable for a longer period of time, but always in the absence of neovascularization. And regarding their origin, possibly from RP cells or can be a variant of calcified structure also. Thank you.
Thank you, Dr. Sameer. I think that was excellent. So I'd just like to emphasize again the difference between ORT and SRT. ORT is intraretinal, it's in the outer nuclear layer, and SRT is something which is sub-RPE, and it's probably calcific originating from the RPE and not necessarily a sign of neovascularization. Okay, so with this we'll move on. Thank you, Dr. Sameer.